I'm going to take you through a series of sacroiliac and lumbo-sacral adjustments. The first one is a side posture hypothenar ilium push for an SI extension restriction. All right. Now, what we're going to do is just place our patient in a basic side posture position. All right. And my stance is going to be, I'm going to be over my patient's knee and thigh and upper leg. This front knee, the camera can't see this, but this front knee is facing forward so it can bend. All right? I'm going to stabilize on my patient's arms. My contact is a hypothenar on the ilium. So there's and specifically the PSIS. So I make my contact on the PSIS. The tissue pull and the vector are the same. It's I to S, medial to lateral, and posterior to anterior. And I roll this underneath me. And then the adjustment comes from using the weight of your body to direct it towards the joint. All right, it looks just like that. I'm not gonna just do a little bit of a mock thrust there, okay? But the important thing is to use your body weight to do it. You'll notice my elbow's in. I'm not pushing the adjustment. I'm using the body to do that. So in this same position, we're gonna change this to a flexion adjustment by altering the contact. Now this upper joint is loaded into flexion when I have a patient in this position. So the adjustment I just demonstrated for you is not one of my favorites. It's a great adjustment, but I wouldn't do it for extension. I would consider it a flexion adjustment because the joint's loaded into flexion. But traditionally, making that PSIS contact and driving it upward and anterior is considered an PI ilium or extension restriction. The variation of this is to change the contact to the adjacent part of the sacrum, right? So if I make the contact on the sacrum, again, here's the PSIS, same basic position, my front knee is free to move, there's the PSIS. I just make that hypothenar contact on the sacrum, roll that under me, the joint's loaded into flexion, and now I've got a nice upside flexion adjustment with a hypothenar sacral base contact. Next, we're going to do a side posture hypothenar sacral push for SI extension, but on the downside. So when I have my patient in this basic side posture position, the upside of the pelvis is flexing, and relatively speaking, the downside is extending. Right? So sometimes you'll see doctors push the leg back a little bit. If it's forward, I would, but otherwise it's usually going to be in a good position right there. So the contact for downside extension will be to contact the sacrum just south of S2. You know, you don't have to get all the way to the apex, but you need to be able to counter-nutate or to bring the sacrum back. So again, since I want to be a little lower on my contact, I'm going to kind of let myself become a little lower. Everything else is the same. My front knee is free to bend. I'm going to locate the downside PSIS, so there's the sacrum. I'm going to actually demonstrate this right through the shorts. All right, I'll bring that leg up a little bit, the top leg with my thigh. Roll this underneath me, right? And then again, the delivery comes from using that body weight from not only my upper body, but that front knee is collapsing and letting the body weight hit the contact, all right? So from here, we're going to go into a side posture hypothenar ischium push. So we're going to change the contact to the ischium, and this is your classic SI flexion restriction, all right? This is actually a pretty good adjustment. Again, I don't even have to move, right? Top side is already loaded into flexion, which is kind of why it takes me back to that first adjustment. We're calling it extension, but patient's flexed, right? So the contact here is going to be the ischial tuberosity. Basically what I'm going to do is make a broad hypothenar contact, pulling down, superior to inferior, down on the ischium, right? Bring that underneath me, and again, use my body weight to create that movement. All right. Elbows tucked in. You don't want to push that with your arm. You want to let the body do all the work for you. All right. And now we're going to come to another favorite of mine, the forearm ischium lift with a kick for SI flexion. All right. So for this, I'm going to change my stance a bit because kicks are generally done perpendicular to the patient. Right. And what we're going to do is use our forearm to load that lower part of the SI joint into flexion and then use the kick to create the rest of the movement for us. So it's going to look like this. Foot's in the popliteal fossa. This is one of the few times I'll make the forearm contact first because usually my knee would go here. If I'm doing a kick, usually my knee would go right by the ischial tuberosity. But my forearm's going to be there instead. So I'm not going to be able to use this position. I'm going to actually have to come back further for this, right? So I'm perpendicular to the table. I take the forearm. If you watch my hand, I'm going to go from pronation to supination as I use my forearm to scoop up the ischial tuberosity. I'm actually lifting it up towards the ceiling. I'll hold that position, put my knee in place. I don't thrust with the forearm. I don't have to. All I've got to do is create that little kick to get me that flexion moment of the upside, lower SI joint on the upside. All right. Next, we're going to do a digital ilium pull for upper SI joint flexion. And again, the joint's loaded into flexion. This is also a kick. So I'm facing perpendicular to the table. Doing okay? Mm-hmm. All right. Foot's in the popliteal fossa. Now I'll make my contact right there. It's on the PSIS, just medial to it. I'll lift up on it, all right? And lift towards the ceiling, place my knee by the ischial tuberosity, and I'll hold that contact and pull it towards me as I add my kick for upper SI flexion. And next we have some supine and prone, sacroiliac and lumbo-sacral jogs. But let's actually move on to the other side postures since I have you in a side posture position. So this next side posture adjustment is a forearm sacral push with a kick for lumbo-sacral flexion. So this would be for the patient who, when you palpated them prone, right, and you palpated counter-nutation, it felt really good. And the patient is extended at the lumbo-sacral junction. You're trying to create flexion there, right? So what that's going to look like, again, it's a kick move. So you're going to come in perpendicular, right? Foot's in the popliteal fossa. Stabilize on the patient's arm. Patient's comfortable on the table. Get your leg in place. If you need to, you can squeeze your adductor a little bit and kind of bring that up a little bit higher if you have to, all right? If your patient's very lordotic, you want to kind of create a little bit more flexion. For this adjustment, you're going to lean over from your waist and just rest your forearm on the sacrum, just across the sacrum, just like that. And this adjustment comes from it's a forearm push on the sacrum as you roll this underneath you with a kick, just like that, okay? We have a similar adjustment for nutation, that's counter nutation, but we're going to require your assistance for this, right? So for this adjustment, we want to create extension. The last one just created flexion. This adjustment is a side posture, digital sacral push with a kick and patient assistance for extension at the lumbosacral joint or counter nutation. So what we're going to do is get in position, it's a kick, right? And I need this to extend. So what I'm going to have you do is breathe in, breathe out, and as you breathe out, I just want you to push your belly out so you extend. Right? So I have my patient help me extend the area. And stabilize the torso. Just turn your head a little bit so you're towards me. Here's my digital contact. I just take these 3 fingers. I make a bridge with my hand. I place the bridge over the lumbosacral area with these 2 to 3 digits right over the lumbosacral area. Right? And again, I press in, leg is relaxed, and my patient breathes in, breathes out, and I push in with my hand and then add a little bit of a kick to create that little bit of nutation, extension movement there. Patient selection is important on that. You wouldn't want to You want to perform that on someone who is hyperextended already, but if somebody's flat, sacrum straight up and down, they've got a flat lumbar spine, posterior pelvic tilt, that's a great adjustment. All right? Now I'm going to come back to the prone and supine drops for the SI. So actually, let's have you supine first. So straighten your legs. So you remember the assessment, right? Hips at 45 degrees, all right? And we're using, bring this in a little bit more, we're using the heel of the hand on the ASIS to assess that upper SI flexion. So what I'll do is turn the assessment into an adjustment by using my body weight to drop onto it. Similarly, you okay with that? If I leave my hand, let me start that again. Leave my hand in the same spot, bring this up to 90 degrees. There's my assessment, nice and gentle. And I can just turn that into an adjustment with the drop, again, using that delivery force generator, using the body to do that. Turn over on your belly. I'm not going to thrust on these last two, okay? But similarly, prop yourself up on your elbows. All right? Similarly, if this is the movement that the patient needed, okay, I'm palpating for that gently palpating for extension down here at the lumbo-sacral junction, and I can follow that through with a drop to create that movement as well. And let me have you lie prone. And similarly, if a patient needs counternutation and flexion at the lumbo-sacral junction, I can just lean into that and use my body weight to create that adjustment as well.